Hello, welcome to our program. Today we are addressing the issue of joint replacement surgery, an increasingly common treatment for those with degenerative joint disease. Degenerative joint disease is a serious matter, but the good news is that it is treatable. Suffering through the pain of this disease can be a thing of the past if you explore the benefits of joint replacement surgery. Joint replacement surgery is one of the most successful surgeries performed today, and it can turn your life around. Hundreds of thousands of men and women each year achieve that goal. If you don't know anyone who has already had this surgery, listen in to this group of individuals who have a lot to share about their own experiences before and after surgery. What they have to say might help you make a decision that will change your life.
I was at a point where I couldn't walk anymore. The pain was so bad. We went shopping. I sat in the car with a library book. I didn't go in the store. I couldn't walk.
Yeah.
So I used to sit there in the car, read my library book, and I go, "Well, when you're ready, I'll be here."
Exactly, they're not going anywhere.
For a good many months it was like that until I decided there's got to be a better way.
Being an outdoor man most of all my life, you know. I'm a woodsman for one thing, and a logger. I do firewood for a living, and that was kind of tough with a bad knee, naturally. So I worked in pain for about 4 or 5 years before I decided to have it done.
Unending pain, sharp shooting pain, pain that keeps you awake night after night, pain that restricts your daily activities. Sound familiar? Do you have similar stories? For individuals coping with degenerative joint disease, whether in the hip or in the knee, the defining symptom is the pain. But what exactly is causing all this pain? The knee is a very complex joint. Working like a hinge, it allows your leg to bend and straighten, bearing up to 7 times your body weight. The joint is normally cushioned by cartilage and lubricated with a small amount of joint fluid, allowing you to sit, stand, and pivot. As you get older, the normal function of the joint can be diminished by disease or injury. The result is pain, muscle weakness, and stiffness. Medication is available to help treat the pain, but individuals with degenerative joint disease inevitably find themselves scaling back their normal activities, shopping once a month instead of once a week, buying 1 bag of groceries instead of 2, avoiding stairs, staying put in your chair. Curtailing your activity in this way, you will initially gain a margin of victory over pain. Gradually, however, it becomes evident how much you are sacrificing to gain that relief. The final straw comes when you realize you've traded away your independence, leaving you frustrated and distraught.
That's right.
You hate to go for a walk.
Yeah, you
You didn't want to.
You couldn't go
do
nowhere.
anything. You didn't.
People look at you
Can't
funny.
drive and you're limping all the
Yeah.
time.
I think the biggest thing in my case was not being able to dance with my wife. We used to love to go dancing, polka dancing.
I had to give up dancing, and I just loved to dance. I thought I was too young to have to give that up.
I have a sort of a hobby. I'm a bookman. I deal in used, rare, and out-of-print books, and we have a booth at Sturbridge Antiques, and we're set up downstairs, so every time you make a sale, you have to climb 13, 14 stairs, you know,
Yeah.
steps to bring your merchandise that you sold, and then come back down. And it was up to a point I just couldn't do the stairs anymore, you know.
I'm not short of breath all the time. Before, I mean, you just kind of be a couch potato.
You were out of shape.
Yeah, well, sure. The unless you do, the less you want to do. I mean, you got to the point that you hated to get up and even get in the car. You get in the car, and when you'd get out of the car, I mean, you'd have to stand there and get your balance before. I mean,
After a while, you don't go anywhere.
Tough way to live.
My life had become a life that I was not happy with.
A life that I was not happy with. Mary, like the others, eventually reached a point where the degenerative joint disease she suffered was seriously compromising her quality of life. After trying medication, exercise, and even losing weight, Mary was still encumbered by pain and was not ready to accept what that meant for the rest of her years. With the option of joint replacement surgery, Mary saw an opportunity to reclaim her life. Maybe you're at that point now. You've tried everything, but you still don't want to give up. And you're definitely not ready to live with it. Joint replacement surgery may be your next choice. Mary and the others had good reasons to make this decision.
My daughter made the decision for me. After her sophomore year in Princeton, she said, "Mother, I am going to stay home and I will not work, outside the home," she meant. "I will take care of the children while you go in."
When this all transpired, I knew I had to have it done. And at the time, my wife was very sick, so I prolonged having it done. And then when she passed away, then I called Doc and he says, "Come on up, we're going to do it right away," because I'd gone to him before. And she worked with the doctor, she knew what it was all about. So I had a pretty good idea of what we were going to go through, but like you say, the pain was so excruciating. It had nowhere to go but up. It had to be better, no matter how it turned out, how bad it would be, it still had to be better.
He took care of both knees, and he said, "I've never done two knees before at the same time." I told him I wasn't coming back. So it was either do two knees or forget it. He said, "Well, if you want them done," so I want them done.
Like you say, the pain was so bad, I just had to have something done. I went to see the doctor, and he x-rayed the knee, and he said there was no cartilage left, you know, bone on bone, like you already know. So I said, "Well, what can you do for me?" He says, "Well, yeah, you know," he says, "cortisone shots, pain pills, that's not allowed, living in pain like this." So I says, "What's my option?" He says, "Surgery." So I says, "Well, let's do it, you know."
After consulting with their doctors, the people sitting around this table all made the decision to have joint replacement surgery. Facing this prospect yourself, you might be wondering, what will it feel like? You might be skeptical. Nothing else so far has eliminated the pain. But most importantly, is it reasonable to expect that surgery will allow you to pick up the pieces of your life again? Before you make a decision to pursue surgery, you will want answers to your questions. In joint replacement surgery, the damaged portions of the joint are removed and replaced with new artificial parts. Typically, knee replacement surgery takes about 2 hours. Knee replacement surgery involves removing parts of your thigh bone, shin bone, or knee cap, and putting in a prosthesis made of metal alloy and high-density plastic. The plastic acts as the new joint's cartilage. Following the procedure, a patient recovering from knee surgery can expect to stay in the hospital another 3 to 5 days. Your individual stay time could vary. After surgery, you will have an IV, and you'll be given a device called a patient-controlled analgesic to help control pain. You may have elastic stockings on your legs, called compression hose. During your time in the hospital, your care team will include your doctor, a case manager, a physical therapist, an occupational therapist, a respiratory therapist, and your nurse. Soon after your operation, the respiratory therapist might be the first to appear at your bedside with a funny-looking device called an incentive spirometer, designed to assist you with deep breathing and coughing. For anyone who has had surgery, the incentive spirometer is useful in clearing fluid out of the lungs. Your recovery from surgery also includes working with an occupational therapist. In anticipation of your return home, the occupational therapist will give you instructions on how to use gadgets like the sock device, intended to keep pressure off the new joint. After a few days, your team will assess your status. If everything has gone according to plan, you will already be well on the way to getting used to your new joint. Your discharge nurse will review what you need to know at home.
You may hear some clicking in your knee, and that's not unusual.
A good attitude about what's ahead of you will be very helpful when you're back home.
You can use ice on your knee after your exercises to help make it more comfortable. And you can expect swelling and soreness to gradually decrease over the next 6 to 12 weeks, but it's going to be swollen for a while.
You've been through a lot, but you have every right to be optimistic about what lies ahead. More than 3/4 of the patients who undergo knee replacement surgery walk afterwards with no assistance whatsoever. It's not unusual, however, for you to stay another day. In the post-op portion of your surgical treatment, Physical therapy is fundamental to your recovery. Indeed, an early commitment to physical therapy will enable you to leave the hospital feeling as strong as possible and confident about your recovery. With an exercise program in place for you to continue at home, your rehab team is confident that you will progress to pain-free movement and achieving your goal of once again living an active and productive life. At first, you may find it difficult to navigate using a walker or crutches. By clearing the house of possible hazards, like loose rugs or cords, your family can help make sure that you don't fall. Your loved ones can also help you by accompanying you on daily walks. It may seem like running the Boston Marathon, but walking down the driveway to get the mail will get easier as you increase your mobility, strength, and endurance. In addition to following your exercise program, it's a good idea not to miss any doctor appointments during the recovery period. Should you have questions at other times, your doctor is only a phone call away. If you have a fever, or if you are experiencing pain at the joint, excessive swelling, or drainage from the incision, call your doctor. Some pain and discomfort after joint replacement surgery is to be expected. People who went through it will tell you, however, that it's much easier to deal with than the pain they experienced before.
They say, what level of pain do you have? You go, I like it's about a 7. They'll say, okay, we'll give you the medication. No.
That's right.
I have all the pain before, I mean, how much pain can you have later? I mean,
Exactly.
you're suffering beforehand.
I started off with a walker, and then they wanted to graduate me to a crutches. I couldn't do too good with the crutches, so I went from the walker right to the cane, and it worked beautiful.
Put the pillow underneath the foot, so she says it'll be a little better, more comfortable. You won't have your heel riding on the mattress. You put a pillow under there, and it seemed to brace it up a little bit.
You're like a new person afterwards.
That's right.
You have to go through your therapy, but you know, and each day you get better and better. The pain just goes
Every
and goes.
day is a little
better,
better.
a little better.
Going up. Better.
And that's what keeps us going.
Right.
I
And the
think.
Life became good again. After the surgery, it was like a miracle.
Life became good again. Can you expect the same results? The fact is, joint replacement surgery is highly successful. Each year, hundreds of thousands of patients find that the quality of their lives has dramatically improved. The pain-free movement that is possible after surgery will allow you to resume those activities you haven't been able to enjoy for so long. In order to reap the maximum benefit from your joint replacement surgery, however, it is extremely important that you stick to your physical rehabilitation program. As the weeks pass and you grow increasingly stronger, you will come to appreciate that exercise is nothing less than the gateway to an active and fulfilling lifestyle. Before joint replacement surgery, years of pain and immobility take their toll on your muscles. Following surgery, you will be asked to follow an exercise program designed to rebuild those muscles and restore flexibility. To do these exercises, you don't need to be a super athlete, but you do need to be super dedicated. The more energy you invest in your rehabilitation, the greater the payback.
They make you do the stretches and the bends and pulling a rope, different angles. And they give you a sheet to bring home to do a number of them. And they tell you to do them at least twice a day, morning and night. And in my case, I was really determined, and I did double on everything on my exercises. And it really worked out.
Every day you get a little better, and I mean, it just, the therapy is, you get used to it once they loosen you up. I mean, there's no problem.
My recovery was good. I did the therapy I was supposed to do, and you have to do it,
I think that's
That's
a
the
big
key.
thing. That
That's
is.
the
That's
key
the
to the
key.
whole
And
thing.
that's the biggest
It's
part.
Definitely.
physical therapy,
Cooperation.
doing
It's
the
a-
therapy.
Must.
If you don't plan on doing your therapy, don't have the
Forget it.
surgery.
I just used a walker for one day after I got home.
Yeah.
And from there on in, every day I just pushed myself to, I wanted to get outside so that I could walk,
Yeah.
and it just seemed every day that was the one thing that I strived for, so that I could walk a little more
Exactly.
And
Exactly.
people say the therapy, that's the hardest part. I think that's the part that I enjoyed the most.
Yes.
Because I could walk up the road a little further and walk back and
You
sit down and then do it again, and it's an accomplishment that you prove to yourself that you can do it. And it makes you feel great, just the idea that you
have to be strong-willed. You have
you
to
want to do it.
it.
Yeah, not that you
That's it.
have to do it.
You want
You
to
want to do it. You know you have to do it. So
That's
I mean, hey, let's make the best of it. And,
Oh, sure.
You're only going to help yourself. I
And it
mean,
works.
It's for
It-
you.
it really
you know, It
works.
really works.
Yes.
It was really great.
Before we close, let's ask our group for their personal recommendations.
You should ask questions and your doctor should answer. I'm sure we've all been there.
Yeah.
Oh, I wish I had asked them this, and asked them that. And so I would recommend that, asking questions and writing them down, because if you're like any of us, you don't remember when you get there. I don't know, your anxiety, your,
That's what it is.
you know,
I
you
was-
forget.
I was lucky, a couple times my wife came with me, so she takes
She
me all
helps, they help.
And that
Us
helps a
women.
lot. I recommend
We're always
that.
butting
You're
in.
on.
The
You're a little
patient-
nervous, and you.
Yes, yes.
Yeah, I'd like to thank my wife also, because she did an awful lot to help me. Life really went back to just about normal.
I really stress the point that you have to do the physical therapy.
Yeah.
And if you don't do that, it's not going to get any better, it's just going to tighten up. And the quality of my life has been better now than it has been in the past 10 years.
Yeah.
I can truthfully say this.
Our group seems to agree. You don't have to accept the pain. You don't have to live the rest of your life on the sidelines. Ask your doctor about joint replacement surgery. Consider the benefits and the risks, and determine whether surgery is the answer you've been looking for.
Well, I got to dance at every one of my children's weddings.
Oh,
And
wonderful.
that was great. And the past few years, we've gone to Europe with my daughter and her children, her husband. And if you go over there, you do lots of walking. And I've done that, and it's been wonderful.
In my own case, I saw the doctor 6 weeks after the surgery, my second appointment, and he says, before you get back to normal, it's going to take about a year. Well, it's a year today.
Oh, is
And-
it?
and it's-
Congratulations.
I'm probably about as normal as I'm going to be.
Oh,
are you dancing
I feel
again?
great,
Yeah.
walk every morning.
Are you dancing?
I can dance with my wife.
Wonderful.
Yeah, I haven't tried to polka yet, but I can dance a
Oh, well,
waltz.
you'll get to it.
We walk every morning, my son and I, which is great because that's a good bond to get into. I climb a ladder. I can do windows, which I never could do before. I can kneel down, and I'm very pleased with the surgery. I have no
Oh, that
regrets.
sounds wonderful.
Yeah.
I can walk 4 or 5 miles a day now, and it doesn't bother me.
Oh,
I
isn't
mean,
that
by
wonderful?
doing that, I've got my wind back.
I lost almost a full year between having a knee surgery and a hip surgery. But I'm back to work doing it 6 hours a day. And no more pain, no more pain.
And I'm doing good. My operation was only in July, and
Of last year's thing.
this year.
This year.
Yeah, it's only July
Oh,
20th.
wow.
Doing great.
Three and a half months.
Yeah, it's all.
And now I can go walking and hunting, and I'm still working 6 hours a day doing firewood,
Wonderful.
you know. And I would have it done again tomorrow if I had to. I'd do it again tomorrow if I had to.
The best birthday present I ever had was having my hip done on my birthday this year, March 19th.
Wow.
Yeah.